I'm Dr. Ray Page. I'm a medical oncologist and hematologist at the Center for Cancer and Blood Disorders in Fort Worth, Texas. And we are a very strong community-based oncology group that services 9 clinic sites in the Fort Worth and surrounding communities.
We are currently in value-based arrangements with Medicare program through OCM, with Aetna through their medical home, with Humana, and with some of the local ACOs in this market.
What our practice realized with OCM is that we needed to better manage risk in our patients.
We were trying to determine, how do we identify the high-risk patients? How do we figure out who is higher risk, not just clinically, but psychosocially?
As we were developing that process, I went to a national meeting and heard about Jvion and heard a presentation of the artificial intelligence tool that Jvion had. And I was actually blown away by what they had to offer.
Here's an entity that is not only assessing the clinical risk of the patient, but the psychosocial risk of the patient, using really interesting publicly available data.
It looked at my practice data, it looked at hospital data, looked at pharmacy data, looked at all the social determinants of health, and was able to analyze all those things and distill those in a way that I could use in a meaningful way to better triage and manage our patients. In a busy community oncology practice, it's not uncommon to see 20, 25 patients a day. And so with that doctor-patient relationship, oftentimes you only have about 10 minutes or so to have a face-to-face interaction with that patient. You just really can't get in at all in that 10 to 15 minute time period the important things that are going on in the patient's life, those social determinants of health. So how are they doing with their finances? What's their living situation? What's their transportation problems? Do they have food problems? So obviously, if you have a tool that can evaluate and assess all those things that I can't obviously get through without having an hour and a half with the patient, those things can really help me move forward with providing optimal care for the patient.
The system identified scenarios and specific patients that we could then reach out to and discovered why, yes, they are having some issues and there are some things we should be looking at.
Our physicians enjoy this program from the standpoint of giving them awareness of their high-risk patients, and it does not impair their workflow at all. So it enhances their ability to be able to get their patients access to the broad amount of services that we have within our practice. When we look at our referrals to palliative care, we've had a 33% increase in the number of patients that have gone into palliative care program, and that has ultimately improved our quality outcomes with regards to OCM.
The Jvion system has identified patients that we've been able to intervene on that we may not have otherwise. And a lot of times we had no idea that the patient had a history of depression, but the system was able to identify that based on some of the clinical data and clinical information that was out there. And that allowed us to move every patient who identified as a high risk for depression to the psychologist so they could reach out to the patient in a more proactive manner. In value-based care, it's that very much 80-20 rule. 20% of the patients are using 80% of the resources. Just how do you find that 20%? There's no way you can focus on every person in your program, every patient. You have to have a mechanism to cull that down to a reasonable number of people that you can hyper-focus on that can make the biggest difference. We've had success in managing value and in receiving shared savings from our partners and reducing our costs. Cardinal and the folks at Jvion have been very responsive We know what their problems are, but a lot of times we just don't have the time and the ability and the resources to go find the solutions. And in many ways, Cardinal's willing to listen and bring forth suggested ideas and suggested solutions. Sometimes, it doesn't work, and many times it does, but I love the way they listen. If I was going to give anybody advice, it would be recognize the clinical, psycho, social, economic, and educational issues with your patients, because it's how you're going to make a difference in value-based care. It's how you're going to make a difference in outcomes. It's how you're going to make a difference in the healing process. And to recognize those, you have to have a system to assist you, because there's no manual way to make that happen.
You can never replace the physician-patient interaction. But again, if you have a huge database that takes into account thousands of variables that you have as a tool, it can help improve your medical clinical decision making for that patient.
You have to have a tool that identifies all those pieces, pulls them together in some logical way, and then scores the patient and a risk stratification associated with all those factors, because every single one of them impact the healing process.
I think the Jvion artificial intelligence tool is a great tool to allow physician practices to be able to better triage their most high-risk cancer patients and give you the opportunity to get them plugged in to our ancillary services in order to improve outcomes. We all want to achieve that triple aim of getting the highest quality of care at the best cost with patient satisfaction. And I think we achieve that with that tool.